Hello, everybody. Please take your seats. We're going to start our session today. I'll just wait a few seconds until everybody settles down. Okay, so welcome, everybody. My name is Leo Yoskovich. I'm from the Hebrew University, the program co-chair of MICCAI 2016. And I have the great pleasure and honor to introduce our second invited speaker. The first keynote speaker yesterday spoke about mostly diagnosis, and the emphasis today will be mostly about the treatment part. So a few words about Dr. Yoav Medan before we start. He's currently an adjunct professor at the Department of Biomedical Engineering at the Technion, the Israel Institute of Technology. And he's also a mentor for entrepreneurs in the medical device field. And this is based on his long experience in the medical devices field. Dr. Medan is best known for his technical and managerial work at a company called Untitled, where he served as a vice president and chief systems architect for 12 years since the inception of the company in 1999 till 2011. Insight is an Israeli-based company that developed MR-focused ultrasound, which is what we're going to hear about. And this device has really gained a lot of acceptance and notoriety in the last few years. For non-invasive image-guided surgery, and today there's been more than 13,000 patients treated with that. So without any further ado, I'd like to invite Dr. Medan to give his lecture.
Thank you very much. I hope you hear me well. Let me just prepare the water, because I'll need it during the talk. So I'd like to thank the organizing committee for inviting me. This is my first time in Athens, not in Greece, but in Athens. So it was a great experience the last 2 days, not in the conference, sorry, but outside. But I hope I'll be able to enlighten you and entertain you, and it's really a great honor for me to present this talk. Okay, so you're asking yourself what this sound has to do with image. It has to do a lot, as I will show you. And first, I would like to disclose my affiliation with the Focused Ultrasound Foundation and acknowledge their support in preparing this talk, because I'm going to give you a broader view than just Insight Tech and just MR-guided focused ultrasound, give you sort of a primer on the field. The Focused Ultrasound Foundation is a nonprofit charitable organization founded 10 years ago, based out of Charlottesville, Virginia in the US. Professor Neil Cassell is a neurosurgeon who founded this organization with the aim of shortening the time gap between idea inception and clinical adoption of this technology. He was involved previously, historically, in bringing the gamma knife to the United States, and when he saw focused ultrasound for the first time, he thought that this is the next thing, and I hope you'll think that too at the end of my talk. But the reason I'm making this unusual acknowledgement at the beginning and not at the end, because I think the mission of the foundation, what it does, may apply to some of you who decide to contribute to this field. And there are quite a number of activities the foundation is involved with, and I highlighted in yellow those who may be important to academic people like yourself, researchers. I don't see the slides on my forward monitor if it concerns anybody. The first one, as you know, it's very difficult to get funding these days. And I think the easiest way to get non-governmental funding for research from basic to translatory supporting initial clinical trials is from the foundation. If you have a good idea, if you have good technology, this is a place to turn to. The foundation also organizes conference, supports internship and fellowships, so through a number of venues, supports external meetings. A recent one was in the US. This is a biannual meeting funded by the foundation, and there is the International Society of Therapeutic Ultrasound. The last meeting was in Tel Aviv in March. Next year is in China. There are several luminary sites, centers of excellence, where people actually can train themselves, 4 in North America and 1 in the UK. I had to say in Europe because the UK, you know, now is a delegate situation. But I think really the most important thing and the role of the foundation is to increase awareness. And as we'll see later, this is a major stumbling block in introducing new technology or new medical modality into this conservative field of medicine. And here are some examples of public awareness events with patients, with physicians, public talks like TED and TEDx, and so on. So my talk is about 2 stories. One is about a technology, and the other one is about a patient. And let's start with the technology. So I'm sure almost everyone here played with a magnifying glass, burning a leaf or paper, you know, with concentrating the energy on the focus. So focused ultrasound is no different than that. Instead of LAN, we have a transducer that basically emits a field of energy which is focused, does it from outside the body into the body. So it's a complete non-invasive modality, and only in the focal spot where the energy is positively intersects, we get the effect, the biological effect, and only there. This is an experiment I ran while at Insightec in the acoustic lab. What you see here is a transducer immersed in a water aquarium. On the left side, you see a phantom, and the transducer is targeted such that it will create a lesion in the middle of the phantom. Just for illustration, the size of this transducer, the diameter is like 13 centimeters. So you see how the targeting is done, and now when you hear the click, this is when energy started to be applied, and you see the lesion formed within seconds in the middle with no apparent damage to anywhere else in the phantom. Actually, if you think about it, this is the only way to do a steak well done in the middle and rare in the outside. Now, ultrasound is a pressure field, and it's a multidimensional basically entity or object, if you like. And I listed here the parameters that we can actually manipulate in order to create a desired effect, and I'll show you different effects that depends on the setting of these parameters. Therefore, when you read a paper that is associated with ultrasound, people always specify the exact parameters that they use because it matters. It's not just, I used ultrasound. It depends what you use it for, from, imaging, which is like, having a brush going over the body, to something which is more aggressive, like a shock wave, like in lithotripsy. So the parameters are, of course, frequency that determines the depth of penetration in our case, the power, which determines the strength of the effect, the pulse duration, and how many pulses, at what rate or duty cycle we apply them, the total energy. Many of the biological effects depend on what is called dose. So there is a certain critical threshold that we need to exceed in order to create an irreversible effect. Otherwise, the effect is reversible, which is good, and I'll show you why. And then, with the proper design of the transducer or a mechanical system or a combination thereof, we can control the spatial distribution in 3D of the energy. So this is an illustration of different transducers. The middle one, this one, is a prostate transducer. So the length of the active part is like 4 centimeters. The width is like 2 centimeters. And you already see the hint for image guidance because the ball in the middle is the imaging transducer, ultrasound imaging transducer. On the right upper hand side, you see a brains transducer. This is the one coming from Insightec. And below, the same one you saw in the earlier clip for abdominal targets. And really based on the amount of energy and the type of the transducer, the size of it, F number mainly, the geometry of the transducer, we can control the size and orientation of the focus. Okay, so what I would like to show you now, that this is really a platform technology and not just, a single special purpose modality. And it can go all the way from helping other therapies like drugs become more effective to activate biological processes in the body, allow the body heal itself. So really, this is really very symbolic that we do this talk in Athens, where 2,500 years ago, Hippocrates actually established the principle of modern medicine, first do no harm. So this is, I think, a great modality, completely non-invasive one, to first do no harm and then cure. So here are some of the biomechanisms. There are 18 plus, and the number is growing as more people come into the field and explore it. And I'll cover only a handful of these in this talk, and I encourage you to search for the rest, depending on your interest. So the first one that has been also known, I guess, from the 30s of the previous centuries is thermal effects. The ability to ablate tissue by focusing the energy long enough into soft tissue. So this involves what we call continuous wave. If you like, it's a single long pulse. Just for illustration, in the case of prostate, we're talking about 40 acoustic watts for maybe 10 to 20 seconds. So you get the idea of how much energy is involved. And it's enough to hit the tissue for 60 degrees for less than 1 second in order to completely destroy the tissue, to induce immediate cell death. It's like freezing the tissue in time and basically deactivating all the biological processes inside it. This is, by the way, why there is very little inflammation when treating with focused ultrasound relative to other ablation techniques like laser or RF that rely on conduction. Here we don't rely on heat conduction. It's an immediate effect in the area of the focal zone. A more recent phenomena that was discovered by a team in Washington University in Seattle is called boiling histotrypsy. And this is an indirect effect where using a train of short pulses, and by short I mean 10 to 30 milliseconds, the air dissolved in the tissue is being boiled locally and causes ablation, local ablation. Again, only in the point of focus there is enough pressure gradient to cause this boiling effect and cause the damage, the irreversible damage. Just to show you how sharp the demarcation between treated and non-treated tissue is, you see here this line, and this is in the liver, and you see here in the brain. So this is really sharper than a knife. It's a few cell width. So you get the transition between fully treated to fully untreated, healthy, if you like, sparing the healthy tissue. Now, the mechanical effects are better known, starting with lithotripsy, kidney stone crushing, and this is technology dated back to the 70s. And the idea here is because of the impedance difference between solid and liquid, between the stone and the soft tissue surrounding it, there is a shock wave created that causes the stone to break. But if it applied more delicately, it can sort of do a massage, if you like, and ultrasound, because it's a mechanical force, it induces a force called acoustic radiation force, and it can displace tissue. And actually, some people are experimenting with propelling small fragments of kidney stones towards the ureter in order to flush them away if they get stuck during the previous procedure. But also, and this is unrelated to intervention, people use it in microfluidics, for example, to sort cells or molecules, blood cells, molecules, and so on. So again, like image also, not image, photons also have radiation force. Ultrasound also exhibit that. And the last one is cavitation, and this is associated with what I hinted before about the dissolved gas bubbles within the tissue. And there is, again, an even newer discovery by a team at the University of Illinois, and they call it histotripsy. And what that does is actually liquefy rather than ablate. This is a cold process. There is no thermal effect, no temperature elevation, and basically it liquefies the tissue, like putting it in a Magimix or in a mixer, if you like. And this is an illustration of a model constructed by research from the Technion, led by Professor Eitan Kimmel, where they basically were able to show that the dissolved bubbles within the dual layer membrane, this is how cells are made by dual layers, and if there is an external pressure field from the outside which is oscillating, it will cause the membrane to oscillate, and this will induce various biological effects. Some of them, those who dive know that it is not allowed to go up to the surface too fast, and this is because of those decompression issues. But if you apply ultrasound, it can also, at certain regimes, be damaging, and therefore I urge you to treat ultrasound with care, especially during the first semester of pregnancy. This is for the women in the audience. And as I'll show later, there are researchers looking into using this for neuromodulation as well as other type of, if you like, tissue massage. So this is histotripsy. The slide is courtesy of Shen Zhu from University of Illinois. These are very, very short pulses, okay, on the microsecond scale, less than 10 microseconds, which means, depending on the frequency, it could be only a few wavelengths. Sometimes it's a single pulse. There's, for dissolving clots, for example, they are now experimenting with single pulse histotripsy. And again, you see the sharp demarcation between treated and untreated. And this is basically, it's a soup of tissue, if you like. And it can be aspired, or in the case of treating benign prostate, it can be flushed away naturally. Here you see a comparison between the three types of ablation that I mentioned. This is thermocoagulation, single pulse, long pulse. This is boiling histotripsy, and this is histotripsy. This is the liquid. And you see here that for the same energy, this is for the same total energy, the effect of boiling histotripsy is more pronounced, basically allows to reduce the treatment time because for the same energy, we can treat larger volume and we can spare the time or reduce the time between what we call sonication. Sonication is the instant of delivering the energy. Okay. The third biomechanism is, rather than destroying, is stimulating. And stimulating biological processes. The first one we observed actually is bone healing or bone growth. And there are devices in the market for wound healing, fracture healing, especially for people with diabetic ulcers and so on. And also muscle reactivation, something I'll show you at the end, towards the end of my talk. I mentioned neuromodulation. This is activation or inhibition of neural activity, again, without damaging, just to create a desired effect. And a very hot topic now in cancer moonshot in the US and other places is immunotherapy. And really this came as an observation that in some experiment done with focused ultrasound, mice that were inoculated with tumors and treated with focused ultrasound cannot be inoculated again and become sick with cancer. And that triggered people to start looking for what happens there. And it's a sort of vaccination. It triggers release of all kinds of cytokines and molecules from the affected sites, especially from the boundary, the transition boundary between the intact tissue and the ablated tissue that triggers the immune response favorably. Okay, so now we have a tool and we want to bring it to the clinic, and there are very good reasons why to do it. First of all, I mentioned one of them, it's non-invasive. And when you start to talk about something which is non-invasive, you spare all the agony of cutting, bleeding, infection risks, and all kind of side effects associated with extended hospitalization. As you know, hospitals are becoming an unsafe place for both patients and the residents. It can be a modality by its own, like treating tumor, or complement to other therapies like drug delivery, which I'm going to show you in a moment. And I think it's going to transform treatment in the sense that if you think about the operating room today, and you saw yesterday the one of the future, the Amigo one, I don't know if you counted how many people there are in that operating room. But focused ultrasound surgery entails a nurse and a physician, and a patient, of course. But this is all you need. The operating room, in the case of MR-guided procedure, is in an MR suite. And in case of ultrasound-guided procedure, it could be the physician office, and that's it. This is the surgical suite. There is no need for sterilization, for example. And the outcomes are pretty immediate, and I hope to convince you with that. And I think overall, if you look at the whole episode of treatment, including recuperation and the restoration of quality of life, it costs much less. As I mentioned, focused ultrasound was known already in the 30s of the previous century. That was like focused ultrasound 1.0. This one is 2.0. It's a device created by the Fry brothers in Indiana in the 70s. And this was the first image-guided focused ultrasound device because the first one was not very successful because there was no way to look into the body where the focus is. You had to rely on a guess, and stereotactic surgery came only years later. And I'll tell you in a moment an anecdote about it. So this is an ultrasound guided system. This is the computer of the 70s, okay? I think it is less powerful than what you have in your pocket or in front of you. And you see two transducers. This is the imaging one, this is the therapeutic one. And we have what we call in our field a positioning unit, but many people used to call it a robotic system, okay? And this is in order to bring the focus to the target tissue, okay? Nowadays, we can do it with electronic steering with a phased array transducer that I'll show you later. The anecdote that I would like to tell you is about Lars Lexell. I don't know how many people heard the name. The Lexell stereotactic frame. He's the inventor of that frame in the 50s. And he also played with focused ultrasound. He wanted to do brain surgery, lobotomies, using focused ultrasound. But he discovered that he cannot actually focus the beam through the skull because the skull aberrates the field. So even though we have a transducer with very sharp focus, when going through the skull, the focus is corrupted and you cannot get really temperature elevation in the focal spot. So he abandoned it and invented, guess what? The gamma knife, okay? So this is an anecdote of one of the failures of focused ultrasound in the 60s, prior to this system. The next wave came years later in the 90s, and I'll show you in a moment. But let me just explain to you how it can be combined, for example, with drug delivery. So traditionally, and especially in Europe, people know that heating the drug, chemotherapy, for example, enhances the effect. And one of the things that can be done with focused ultrasound is what is called hyperthermia, again, non-invasively and in a focal way. But really it shines when we want to put chemotherapy now has a systemic effect, and really the dose is limited by the damage to the healthy tissue, and now encapsulate it at higher concentration in the target organ, like in the liver. Let me go back. Do we see the animation? I don't see it running. Here. So instead of systemic, you see it now go onto the liver. And basically what we do, we take this is a microbubble size, is smaller than a blood cell. This is several microns, and a microbubble is 100 or so nanometers. We pack it with chemotherapy, and also could be contrast agent like gadolinium 4-MR in order to enhance visibility, and then inject it systemically. And using focused ultrasound, okay, select, basically it collects in the liver, and in those tumors here, we can then focus the ultrasound and cause the microbubbles to dissolve, release the payload, and basically over days and weeks induce shrinkage, only locally. So the toxicity is local. We can increase the dosage and reduce maybe treatment time in terms of weeks in order to accumulate the necessary dose, do it much faster. This is another case in enabling large molecules go into the brain, into brain tumor. And as you may know, we have what is called the blood-brain barrier that protects our brain from toxins. And the sheer mechanical force of the ultrasound can actually shake the tissue and reversibly make some pores through which the molecules can get into the tumor. This, again, can be done locally. And there are already phase 1 trials ongoing in Toronto to test that. So basically, there is a drug in the market, liposomal chemotherapy, called doxorubicin, and the experiment is to check whether it can increase the efficiency of delivery of doxorubicin into the brain. Here's a collection of devices. What you see on the left-hand side is a system from Philips. And this is for abdominal target, mainly uterine fibroids. It is approved in Europe, but not in the US. On the upper right-hand side, it's the InsightTech brain device that has recently been approved by the FDA and is approved in Europe. Here below, on the right side, this is a device coming from a French company called Theracleon. And they use it to treat benign breast tumors and head and neck tumors. Benign head and neck tumors, they don't have yet approval for cancerous ones. This is a device coming from Taiwan, from a company called Alpinion, and for treating, again, a benign tumor of the uterus called uterine fibroid, and this is the transducer. And the last one is again from France, from a company called MICCAI. This is the transducer. This is to treat glaucoma. This is transducer that you put around the eye. So you see, it's very small. So in a sense, for every part of the body, we have a different system. And just to illustrate it further, these are the endoluminal devices. The upper row is all for prostate. This is a device coming from Sonicare. The probe is here, so it's an endorectal probe. This is from France, a company called EDAP. Again, you see the posture, and the probe is here. And this is from a company, Canadian company, called Profound Medical. It's now a Philips company, basically. And this is a transurethral. It's like a catheter probe that goes into the urethra, and I'll show you later how it works. And below, we see catheter-based devices that are aimed at various ablation procedures. This is for atrial fibrillation.